Welcome to Arazy Group's regulatory update. In today's update, we are going to give you a regulatory wrap-up in India that will include information related to the CDSCO medical device frequently asked questions. This short video summarizes key clarifications issued by CDSCO in 2 FAQ addenda to the Medical Devices Rules, 2017, published in April 2025 and July 2025. The principal questions and answers have been extracted and organized by subject to provide a clear overview of the implications for manufacturers, importers, and registration holders. A common query concerns the requirement for biocompatibility testing. CDSCO has clarified that such testing is mandatory only for devices with body contact and must be conducted in accordance with ISO 10993 standards. Existing data may be reused if generated for a similar device, provided the material, supplier, and manufacturing process are identical, supported by a justification and biological risk assessment. Any change in supplier, material, or process necessitates revalidation. In addition, complaints or adverse events require fresh for-cause testing. Another frequent query concerns the release of sterilized devices based on parametric release without batch-wise testing. CDSCO has confirmed that this is permissible, provided the sterilization process is validated in accordance with applicable BIS or ISO standards, such as EO sterilization, ISO 11135, gamma sterilization, ISO 11137, and steam sterilization, ISO 17665. Parametric release is acceptable where validation and routine revalidation are maintained, ensuring flexibility while upholding stringent control over sterilization quality. CDSCO has clarified the licensing requirements following structural changes such as mergers, ownership transfers, or conversion from a firm to a company. A fresh license is mandatory in all cases. Manufacturers, application within 180 days, importers notification to CDSCO within 30 days, and application within 180 days, registration holders, application within 90 days. During the transition period, the existing license or registration remains valid until the new application is either granted or rejected. Our regulatory information and registration management software is the answer to all your regulatory needs. With an intuitive user interface and real-time data, License Sale provides complete project management, infographic analytics, effective collaboration tools, future market access planning, and advanced reporting capabilities. You'll control your global medtech registration activities like never before. In its July addendum, CDSCO provided clarifications on re-imports and overseas outsourcing. For re-imports, the requirement for laboratory testing prior to clearance is determined case by case by the Port Office in coordination with the Zonal CDSCO office. Regarding the outsourcing of activities abroad, such as coating, engraving, or batch testing, this is permitted subject to obtaining a No Objection Certificate, NOC, from CDSCO. Supporting documentation, including the valid license, agreement with the overseas partner, and device details, must accompany the request. CDSCO has also clarified labeling requirements. For imported devices, labels must comply with Rule 44 and include space for India-specific information, which may be added subsequently through stickering. For domestically manufactured devices, labels must fully comply with Indian requirements prior to marketing, with no provision for post-production modification. These measures ensure that end users consistently receive complete and accurate product information. CDSCO has outlined specific requirements for free sale certificates, FSCS, for Class A and B devices, and FSC from a reference regulatory authority, US, EU, UK, Canada, Japan, or Australia, is required. Where this is unavailable, CDSCO may accept an FSC from the country of origin or another marketed country, supplemented with safety or performance data. For Class C and D devices, the requirement is more stringent. If approval from a reference country is absent, a clinical investigation in India is mandatory in addition to submission of an FSC. The evidence requirements therefore increase with device risk class. Thank you for following our regulatory updates. If you have any questions, need more information, or would like to book a demo of our software, please email us at info@arazygroup.com or simply head to our website and head to the Contact Us page.